Hey everyone, I'm Alex Filbert, the director at the Larned Area Chamber of Commerce, and I am joined today by Josh Sapp. He is our advisor with the Heartland Benefits Group, and we are here on this video to do an overview and kind of a question and answer format to get you all excited about something I am super excited about. It's a brand new benefit that we are going to offer our chamber members here in January of this next year, 2021. So what's this big new benefit, you ask? Well, if you've heard a little bit of the buzz going on around town, because we've been trying to do some promotion about this, health insurance is a huge, huge deal. So we are fortunate enough, and thanks to Josh and all of his efforts, in January of 2021, this next year, just a matter of months away, we are going to be able to offer the Larned Area Chamber Health Plan for all of our chamber member businesses, organizations, and just have this option available to the community. So we are really, really excited about this. And Josh is going to talk a little bit more about what an association health plan is, and then we're going to dive into all of the questions that either we've heard from you as businesses, organizations, just inquiring minds in the community about what is this chamber health plan and how can I get involved? What are all of the details? Give us examples of the plans, costs, all this and all that. So I'm going to turn it over to Josh and we'll start rocking and rolling.
Awesome. Okay. Well, Alex, I appreciate the warm introduction. Just for those of you who are watching this, we are going to, like Alex said, be doing some question and answer type information to provide to you guys the ins and outs. We tried to think of all of the potential concerns and questions that an employer might have about this health plan. And we'll get into some of those deeper details as we go through some of these questions. But the first thing that I want to hit on is what exactly an association health plan is. An association health plan is essentially this. You're taking not just one group of employees out to underwriting to get health insurance rates, but you're taking many businesses combined into one big group to buy down the insurance and leverage that buying power to provide more economical rates for the health plan. So it would be a whole heck of a lot easier for 15 or 20 or 50 businesses to come together to create, instead of a 1, 2, 3 life group, now we've got a 50, 100, 250 life group. And that's going to make it more affordable for each individual on the plan and each employer that is contributing to their employees' health premiums. So that's essentially what an association health plan is. The chamber is considered an association, a bona fide business league. So they are acting as a sponsor for the employers that are chamber members, the business chamber members, to participate and have access to this value-added benefit in health insurance. And if you're in the time and you've been watching the news and you've been dealing with some fears about coronavirus, COVID-19, this is actually a perfect time to start putting together what we would call a recession-proof plan, health plan, because technically we're in a recession with COVID-19. And so to be proactive about it and about our health insurance choices and our options, the chambers decided to put this plan, implement this particular strategy to provide economical rates and costs year in and year out, and be able to control the things that you wouldn't necessarily be able to control if you were in a traditional type health insurance plan. So let's get started, Alex. I think just that first question, if you want to ask the questions and then I'll answer them, that's fine with me.
Sure thing. Okay, so our Larned Area Chamber members are made up of various businesses, both large and small, as well as organizations, and we also have individuals joined in as members. So can you tell us a little bit about who can apply or who is able to tap into this benefit?
Yeah. So Technically, through the federal law and the state of Kansas Insurance Department and the state of Kansas Department of Labor, technically in the bill that was written to allow chambers to do this, the participants have to be a business. And so whether that's a sole proprietor of one owner operator, or whether that's a business of 500 employees. Also, organizations such as nonprofits or 501c3 organizations, if they have employees, even though they're not for profit, if they have employees and they pay W-2 employees, then they can provide this benefit contingent on them obviously being a chamber member and being current on their dues. Those businesses can participate regardless of whatever industry they're in or whatever class of business they might be registered with the state. So sole proprietors, if you have a business and your business name is registered as your chamber membership, you have access. Members that are, a few to a couple hundred or more than a couple hundred employees will also have access to this benefit. No problem.
Awesome. And this is another great plan for farmers too, as well, correct?
Yep. So farmers, we have a few different chamber health plans out there, and a few of them are down in Southwest Kansas. And down in Southwest Kansas, as you guys know, in Central Kansas, farming and agriculture is a big deal. And so we have a lot of farmers, independently owned farms that are business chamber members. They pay business taxes on their farm. So they're registered as a business with their farm, with the chamber. And therefore those, whether it's, a mom and pop, small operation, or if it's a large farming operation that has multiple farm hands employed and paid via W-2, then yes, they can have access to it as well.
Awesome. So as, say I'm an employer, what would be my financial responsibility?
Yeah, so federally, it's required, according to the Affordable Care Act or the ACA, that an employer pay at least 50% of the most economical single option. So you might be asking, okay, what does that even mean? Well, we're going to be building this plan with multiple health options available. So with every health plan, there are 4 different coverage levels: a single rate, a single and a spouse rate, a single and a child rate, and then a family rate. So if there are 3 health plan options, there's going to be 3 single options to choose from. The employer is only required per the ACA to pay half of or 50% of the most economical single coverage level option. But the beauty of this is that each employer is going to get their own invoices, and I'm probably jumping ahead here, but it makes sense. It's relative. Each employer is going to get their own invoice for the employees that are participating, and it's going to say X amount of dollars that's due. As long as the employer has paid at least 50% of the single option, I don't care how the total dollar amount is paid. Because some employers, I may want to pay 80% of the single, or I might want to pay 100% of the single. The administrator and the advisor and the chamber don't necessarily care how that money gets to where it is to be paid in your premium, your total premium, as long as the employer has contributed at least 50% of that most economical single option.
Okay. And you mentioned premiums. So are the premiums tax deductible?
They are indeed. Yeah. So it's going to work the exact same way as if you had a traditional insurance plan on your own. You're going to set up however it is that you set up to withhold that money, those premium dollars, from your employees, whether that's some kind of accounting software or HR company or payroll company, or chicken scratch on a piece of paper. You're going to withhold that money however you're currently doing it, or however you would normally do it. And then that employee writes that off as a tax deduction at the end of the year.
Okay, awesome. So can the employee portion be withheld from their paycheck?
Yep, that's exactly.
Okay.
Yep, kind of leads back into that last question. Yes, it can be withheld however you want to withhold it. It can be withheld and make it as easy as you want to make it, or as difficult as the individual employers would like to make it. Yeah.
Okay. Okay. Um, so talk a little bit about the participating businesses or the participating employers. How will they get an invoice?
Yeah. So again, each employer is going to get their own invoice that will be coming straight from the administrator. So the third party administrator that is obviously administrating this plan, for the people who are participating and also for the chamber sponsorship, is called corporate plan management. It's a locally owned third party administrator, or TPA if you're familiar with that term, or acronym, out of Topeka. They service association health plans across the state of Kansas, such as the Kansas Association of Independent Crop Consultants. That's probably pretty prominent in the Larned area, crop consultants. They service the Kansas Veterinary Medical Association, and also 5 other states. They've got the Veterinary Medical Association for Oregon, Oklahoma. I don't know how they got Oregon, but yeah, the broker was genius about it. And a few others, veterinary medical associations across the country. But yeah, anyway, corporate plan management, the TPA, will be sending those invoices to the individual businesses directly to the business address, and that is handled to be paid. The premium will be paid straight to the TPA to administer those funds.
Right. So for all of our businesses, community members, organizations watching, don't expect to get an invoice specifically from the chamber. So be watching for that invoice from corporate plan management.
Yeah, and to kind of tack onto that, I'm glad you said that. The chamber is simply acting as a sponsor. They don't get any kind of confidential HIPAA, information. They don't want that liability. They don't want that responsibility. They're not getting any of that information. All they're doing is working alongside me and an insurance board that has been put together to represent and maintain the fiduciary responsibility for this plan. And for those of you who may not know what a fiduciary responsibility is, the chamber, as the sponsor, has a duty to always look out for the best interest of the participating members. They already have that responsibility, already, but even more so with the health plan. And Alex, I don't remember if we even get into the health insurance board. Do you remember? I don't think so. I'll just hit on it real quick while I've said it already. The health insurance board was a hand-picked group of people from your community, with experience in insurance, with experience in healthcare, with experience in governing leadership, county leadership. All of these individuals are coming together for the sole purpose of providing an invaluable benefit in the form of health insurance to the small mom and pop shops that may not be able to afford health insurance out on their own. So coming together, banding together to make this one big group is going to allow these small mom and pop shops to, one, provide insurance coverage, health insurance coverage for themselves as business owners, but also for their employees, because there's a huge turnover in the small business industry. Turnover in employees. It's hard to retain those employees. It's hard to recruit those employees. And it costs money to continue, and that turnover costs money. And so if we can recruit skilled workers by being able to offer benefits to them as a small business, we're more than likely going to be able to retain those members or those employees for a longer period of time, because we're offering a competitive benefit into that particular business. So I just wanted to mention that.
Yeah, and I'm glad you did, Josh, because that's one of our goals for this project, this benefit itself, is to, of course, we're always trying to look out for our businesses, our community, but we figured this is one of those benefits that can really, really make a difference.
Absolutely.
great positive difference. So hopefully, hopefully you guys join in and learn a little bit more about this and say, yeah, we want to do this. So this is just one of those things that we are doing for you.
Sure.
So next question, am I limited by the number of times I can visit the doctor?
Yeah, so it's pretty common these days for employers to implement a health insurance benefit to their employees through, let's say, Blue Cross or United or Cigna, Aetna, Humana, any of those big name carriers. What those carriers are implementing for those health plans are office visit limits. For example, I've heard of a group that was limited, their employees were limited to 6 office visits a year. How in the world do I know if I'm going to need more than 6 visits for that year? I could get pneumonia, I could get the flu, I could have a major surgery. These things. Why are we limited to the amount of times that we need to go see a doctor? If I need to see a doctor, I want to have as many opportunities during a plan year to go see that doctor. I don't want to be limited and have to think, okay, well, I need to stay inside all winter so I don't get a cold and get, the flu. I don't want to have to deal with that. I want to make sure I can go. I'm not limited to the amount of times that I can go. So in this plan, you will not be limited to the amount of times that you can go see your primary care physician. Absolutely not.
Okay. And that also leads us into our next question. Which providers will be in this network?
Yeah, so Alex, I believe we're going to disclose a brochure to the membership at some point. Be on the lookout for that. I don't know if it'll be through email or what, how Alex is going to, geniusly do it. But there are 2 networks that we're going to utilize. The first is called Providers Care Network. And there's a good reason why some kids can't spell these days, because they tried to get real fancy with the name. It's PROVIDRS. So like doctors, provide doctors.net. Or providerscare.net. If you go to that website, you can do a search to find all of the doctors that are included in that network within a 25-mile radius from Larned or in Pawnee County. I would imagine, because I've never been proven wrong, that the doctors that you are utilizing, the PCPs that you're utilizing and your employees are utilizing, are within that Providers Care Network. That's the biggest privately owned network in Kansas. So any claims that are billed or any claims that occur in Kansas are going to be billed through that Providers Care Network. And that's where we're able to get the steepest discounts on the cost of care for the patients, the members that are utilizing the plan. Also, because we travel, we don't just stay in Kansas our entire lives and never step foot across state line. We travel, so we want to have coverage outside of Kansas. Let's say if you're with Blue Cross Blue Shield of Kansas, anytime you go see a provider not anytime, 99% of the time, if you step outside of the state of Kansas, you will be charged an out-of-network fee. And those costs are correlated to the out-of-network part of your policy. With this, we're going to use what's called the First Health Network. If you go to firsthealth.com, no funny spellings there, firsthealth.com. You can use the search tool there as well. You don't need an access code to search on First Health, but on Providers Care, it notates underneath the search option to utilize the acronym capital P, capital C, capital N, Providers Care Network, and then you can access all of the search functions available. But with First Health, nationwide coverage, I could be, I think, Alex, you've probably heard me say this example before. I could be fishing for lobster in Maine on a vacation, fall off a boat, break my leg, and I can find, by searching in the First Health Network, an in-network doctor in Maine. One of my clients in Northeast Kansas, his daughter goes to UCLA. Well, she's under his coverage. She has an in-network doctor in LA because of the First Health Network. So those are the 2 networks that we're going to be utilizing. We're also trying to, and this is contingent on how the plan is structured and built, we're also trying to look at a way to utilize the local hospital as much as we possibly can, because that's what this is all about, implementing a community-driven effort to drive down the cost of healthcare. And so if we can use Pawnee Valley, is it Pawnee Valley Community Hospital or Pawnee Valley
Yep.
County? Okay, Pawnee
Yep.
Valley
Pawnee
Community
Valley
Hospital.
campus.
Okay, yeah, if we're utilizing Pawnee Valley, then that would be a direct relationship between the chamber-sponsored health plan and Pawnee Valley. But we would still want to make sure there's adequate amount of coverage in Kansas and beyond the Kansas state line.
Very cool. Very cool. So our plan is projected to start on January 1st and have that same date as the renewal date.
Mm-hmm.
Will you explain a little bit about any of our current chamber members that their renewal date is, say, July 1st or August 1st or another date throughout the year?
Yeah, so I would imagine, 80% of the membership being at the January 1 renewal, if they even offer benefits. If the businesses don't offer benefits, then there's no issue joining January 1st. But if you have a mid-plan year renewal, let's say I'm a bigger employer and I'm with Blue Cross, and my renewal is in July, like you said, the fiscal year, not the calendar year. Well, I can still join the plan at my renewal. I can either cut it off short in January, 6 months short in January, and start with the chamber plan then, or I can join mid-year, mid-chamber plan year at July 1 by cutting my plan off 6 months short on the back end. So you can still come on at your renewal. You can come on at any time. We just need to know in advance so we can gather the necessary information from your group to get it through underwriting and get you set and ready to go for that time that you're going to be joining.
That makes sense. So how many employees would need to participate for the employer to be able to offer this plan to them?
Yeah, that's a great question. And this kind of confuses people. So I'm going to make this really, really, really easy. Think about your employees. Maybe you sole proprietors out there, you are owner operators, you are your own employee. So companies or businesses that have more than a few, think about all of your employees that meet the 30-hour or more full-time eligibility mark. So the employee has to be considered full-time, not seasonal, not part-time, but full-time and work 30 hours or more a week. Those are going to be the employees that are going to be eligible for this. The insurance board, we've already decided, not we, because I don't decide anything, all I do is advise, but the insurance board has already decided that 65% of the full-time eligible employees have to participate for the business to offer it to the employees. So let's say I have 10 employees and 3 of them have some kind of waiver, qualified waiver. What that is they have coverage somewhere else. Maybe they have coverage on their spouse's plan. Maybe they have coverage through their parents. Maybe they're out on the marketplace exchange. Those 3 individuals don't count toward the 65%. So now if they wanted to stay where they're at, all I have to do is get 65% of the 7 remaining to participate for me to be able to offer it to them. I hope that makes sense. That's about as simple as I can put it. But 65% is the number. Now, sole proprietors, if you want, and you're the only employee, if you want to participate in this, 1 divided by 1 is 100%. Okay, so you would meet that 100%. You would meet the 65 by being 100%. I hope that makes sense. That's about as easy as it is to explain.
Right. And we'll go over this later, but if there are any questions that you have that we haven't answered already or that we don't answer in this video, we will have an opportunity here in August 19th at our community forums that you can ask any questions we've missed or your specific questions, but we'll get back to that one.
Sure.
We'll go over it soon. But a big question that we have had over and over and over again is, how much is this plan going to cost?
Yeah, and I wish I could give you a relative range. The short answer is I have no idea how much it's going to cost. There are so many different factors that play into the underwriting process um, that determine the rates. So let me give you a few different examples. Um, the amount of people that participate in this plan is going to attribute to some of the economical cost. If we only have 30 people participate, those rates may not be favorable. One, considering the amount of people participating, but two, considering the overall health assessment of that group at its core. Let's say we get 500 people to participate. Well, that's a bigger number, right? So we're going to buy down the insurance because we have a bigger block of business. And then maybe that bigger block of 500 people have less health concerns as a whole than that group of 30 did. So it really depends. The overall health assessment of the group, the size of the group, what the average age of the group is. This is not going to be an age-rated plan, so don't misconstrue what I say by age plays a factor. It's not age-rated, it's health-rated. And so average age plays a big role. If our average age is 55, then maybe our health plan rates aren't going to be favorable, because if the average age is 55, a lot of or at least half of our members, our participants, are over the age of 55. And that can be cause for an increase in cost because there's more health concerns with individuals who are over 55 compared to if we had an average age of 30, our rates could be extremely favorable because there's less health risk associated with those individuals on the plan. So the only way that we're going to be able to determine what the rates are is to obtain what's called a health questionnaire, or an individual medical questionnaire, an IMQ. Alex is going to be sending that link when that time comes. She's going to be sending a link directly to that health questionnaire to all of the chamber members for them to complete, okay? Them and their employees to complete. That's going to give us a current snapshot of the health of this group, an overall snapshot of the current health of this group, which is going to ultimately lead, and it's required. I can't give you rates if I don't know the health risk associated with the group. I mean, that just makes sense. That's like me trying to put an offer in on Alex's house. I'm going to try to buy Alex's house without ever seeing her house. I don't know how old it is. I don't know what condition it's in. I don't know what the square footage is. I don't know what needs to be repaired. I don't know any of that information. So how am I going to be able to give her a fair offer? Same concept applies to the health plan. So be on the lookout for that IMQ or that health questionnaire, and that's what's going to be required to determine the rates. Keep in mind, even after completing the health questionnaire, you're not obligated to this plan one bit at all until the plan start date, until you've enrolled and the plan start date is upon us.
Right. So I guess just to add on to that, a goal for you as employers, community members, to hope to get this plan, the cost as low as possible. I am challenging all of you to get as many people to fill out that health questionnaire as possible, because if you don't fill out the questionnaire, then you won't be able to be considered for the plan this year.
Right.
So
yeah,
the goal is, yeah, go ahead.
I'll just to add to that though, it's extremely important. Remember those 3 individuals of my 10 employees that have a waiver. I'm on my spouse's plan, I'm on my parents' plan, I'm out on the exchange. If they wanted to fill out the health questionnaire, even though they have coverage elsewhere, if they wanted to fill out the health questionnaire and be considered for the plan when those rates come out, maybe those rates come out 30% better than what they currently have. If they didn't fill out the health questionnaire, they cannot participate. And they're going to be really, really kicking themselves because they would have wished they filled out that health questionnaire. So it's extremely important that we get as many people to complete the health questionnaire as possible. Again, those questionnaires are 100% confidential. The chamber doesn't see them. Alex doesn't see them. I don't even see them. The administrator, that when that form is submitted, it populates directly into the Larned Area Chamber Health Plan file at the administrator. and then they do with that information what needs to be done to get it to underwriting and get those rates put together. Yeah.
Yep. So if you're interested in this at all, even you're just thinking, maybe, definitely complete a health questionnaire.
Right.
Yep. So let's go back to coverage.
Mm-hmm.
Will pre-existing conditions be covered?
Absolutely. Yeah. So that again is another Affordable Care Act or ACA federal requirement. Pre-existing conditions have to be covered. You cannot, what's the word I'm looking for? I lost my train of thought. You cannot deny someone coverage because of that pre-existing condition. It has to be allowed.
Perfect. And I'm going to assume the same thing with preventative care?
Yep. All preventative care is another ACA Affordable Care Act requirement, federal requirement. Those are absolutely important and imperative that people do those to, pre-screen potential future issues and concerns. So yes, all of those are actually going to be covered at 100% by the plan.
Perfect. So can anyone participating in this plan use our local pharmacy or any pharmacy of their choosing?
Yeah. So, and I failed to inquire about this with the PBM that we're going to be utilizing, a prescription benefit manager. But yes, there will be a prescription manager for the plan called RX Preferred. That prescription benefit manager is located in Nashville. They have about 69,000 pharmacies within their network across the country. Down in Southwest Kansas, which is, I believe, even more rural than Larned is, the Dodge City area, we haven't had any issues with coverage and in-network pharmacy providers in that area. But I will definitely I'll be inquiring about like a 50-mile radius around Larned to just confirm who's in network with pharmacies. But I would imagine if you have a locally owned pharmacy, as well as maybe a commercially ran pharmacy like a CVS or a Walgreens or a or a Walmart, those are going to be in network as well.
Great. So talking about vision and dental,
Mm-hmm.
Can you explain if vision and dental will be in the network and what our plan is for that?
Yeah, absolutely. So the goal is to provide not only health, but also dental and vision. With the dental and vision plan that we're going to build into this health plan, there's not going to be any network. So essentially all providers, all dentists, all eye doctors are going to be in network. And the beautiful thing about that is you can go utilize your local providers as much as possible. Go use that local pharmacy, keep them in business, go use those local dentists and those local eye doctors to keep them in business. We're seeing right now an extreme decline in locally owned small provider clinics because of the insanity of the traditional insurance market. Excuse me. So yes, dental and vision, the goal is build the program, the dental and vision program, to be administered by the same company, Corporate Plan Management. That way you'll only have one card instead of 3 different cards, health, vision, and dental. They're all going to be on the same card because they're all going to be administered by the same company. So that's super convenient. And any and all eye doctors and dental dentists are going to be considered in network.
Okay. So this is a pretty great benefit for all of our chamber members, but say you are not yet a chamber member, like how I slid yet in there.
Yep.
So even if you are not a chamber member, you cannot receive this benefit. But if you were interested in joining, of course, we would love to have you. But if you join the chamber, you do, as a business, you do have the eligibility for this plan.
Absolutely.
So do you want to go a little bit more in detail, Josh, about, say if we have someone join the chamber and it is, say, mid-year, how they can join in? Would that still be in with the mid-year renewal?
Yeah, absolutely. So even if you're not a chamber member, or yeah, let's say you're not a chamber member, a current chamber member, and you want to join for the health insurance, absolutely. We're not going to deny you the opportunity to have that kind of coverage. The only stipulation is to be a chamber member. So you're going to need to make sure your chamber membership is current, and whether that's at renewal or mid-year as a new chamber member coming on board, making sure that chamber membership is paid. What happens if my chamber membership lapses? My health insurance is going to lapse. So it's a very, very important that our membership dues are paid and current as quickly as they can be, as Alex sends those invoices out. So anyway, yes, as a potential new chamber member, you can make sure your chamber membership is good and it's paid. And then moving into whatever month we're moving into during that plan year, you can participate in the health
Great.
plan. Yeah.
Great. So we've talked about how January 1st is our start date.
Mm-hmm.
When will the open enrollment be for this plan?
Yeah, great question. So 2 months prior is when we're going to start sending out the open enrollment information. So that'd be 11/1, November 1st. That's going to give us plenty of time to get that enrollment done, get any new packages prepared and sent out, adjust the census accordingly to people who might have fallen off or new employees that are coming on. So 11/1 is going to be when open enrollment is.
Okay. Okay. Are qualifying events approved for access to this coverage?
Yeah, this is kind of a tricky question, and kind of maybe a confusing answer, but it's a valid question. Let's say I live in the Larned area and I work for a company who is participating in the chamber health plan. However, I don't have that coverage. I don't have the chamber health plan coverage. I have coverage through my spouse with a business who's not a chamber member. They have insurance elsewhere. What if my spouse loses her job, or she quits, or something happens and she's not covered by that employer health plan anymore? Do I, as an employee of my employer who's participating in the plan, do I now have access to join this coverage, the health plan coverage? Absolutely. That qualifying event, even though it was technically her qualifying event, it directly affects my coverage. Therefore, I have access now to join in my employer's sponsorship through the chamber health plan. So yes, all qualifying events are considered.
Great. So this plan is coming up on us pretty soon. And I had mentioned earlier that we were going to talk more about the community health forums, different things like that. So can you give us an overview of the timeline as we move forward?
Yeah, so it's pretty self-explanatory. We're going to get this information out to you at some point, but just to hit on a few things, you'll have it in paper, but just to hit on a few things right now while you're listening, some things to be prepared for. January 1 is the start date. We're going to be sending out some communications, some informational communications to you guys via email or newsletter, or however Alex is going to do that, just to keep you in the loop on what's happening, and keep that interest up as much as we can. There's going to be a brochure that's going to be sent out, like I mentioned earlier, with the provider network information in there. Also in that brochure, it's going to be listed all of how we built the plans. We built these plans from the ground up. There's not another plan on the planet like this. It's extremely unique to the decisions that were made by the insurance board. And we're going to be able to manage that year in and year out and make tweaks as needed. You just can't do that out there on the fully insured traditional insurance market, if you will. So we're going to send that plan brochure out. We're going to send this link out to you guys and have this information available. But August 19th, like Alex said, is when we're going to be hosting 2 community forums or town hall meetings, or whatever you want to call them. I will be there in person to essentially give an entire comprehensive presentation to you guys, to hear it straight from the horse's mouth. I'm not calling myself a horse, but the phrase still applies. You can ask me any and all types of questions that aren't, covered in this video, that weren't covered in this video. What did we say? Noon and 5:30. Is that right?
Yep.
Okay. Date's been decided. Time's been decided. Venue's not been decided, I don't believe. Or
so the venue, of course, with all things COVID related, we are hoping that we will be able to do this in person. And if we are fortunate enough to do that, both of the community forums, both at noon and 5:30, will be in the Chamber Jordan Room at 502 Broadway.
Okay.
And if we are not able to meet in person, or just depending on how things are at that date, we may also broadcast this on Facebook Live or just have other options. So even if you are not able to attend in person or that date doesn't work for you, you still have the opportunity to learn about this plan.
Absolutely. Absolutely. And my information is going to be included in a majority of the information that Alex is going to be sending out. So you can contact me directly. Alex isn't an insurance expert, so don't expect her to be able to answer any kind of in-depth, crazy HR insurance questions. Direct those straight to me, and I'll be happy to answer them for you. It's extremely important to remember this date, September 1st, is going to be, and we're going to reiterate this a few times as we send information out. September 1st is going to be when we can disclose the health questionnaire link. Remember, when you click on that link and your employees click on that link, they're going to be directed straight to the health questionnaire. That health questionnaire is 100% secure, encrypted, safe. You're going to put all your information in there, what's asked. That's going to be then forwarded and directed immediately, populated immediately into the administrator. So September 1st is when that link is going to be sent out. We absolutely need those health questionnaires done within 3 weeks. So we're giving you until September 22nd to complete those health questionnaires, you and all of your interested employees. The rest is going to be back-end stuff. So after that health questionnaire is completed, you're going to have some downtime. We're going to do our work on the back end through the underwriting process, and finalizing the plan structures and all of that information. And then we're going to get back to you roughly October 23rd, somewhere around there, with the underwritten rates for the group that participated in completing health questionnaires. So that's another date to remember, October 20th to the 25th. Those preliminary rates are going to be disclosed. Then there's going to be an enrollment review by the underwriter for those of you who enrolled at that point on October 23rd. Also in that disclosure of rates is going to be a link to the enrollment, and that's when enrollment will open, whenever that email is sent out. So vitally important to keep an eye out for that stuff. Again, Alex is no insurance expert. She's learning as we've been, going through this process. But direct any kind of questions you have, small or large, to me, and I will absolutely take care of them.
Perfect. So Josh, you've really covered all of the questions that I've had, that I've been asked by any of our inquiring businesses, organizations, just general individuals that are saying, hey, this sounds like a really cool idea. Tell me a little bit more about it. So I hope that this video has been beneficial to all of you, all of our watchers, all of our businesses, organizations, and community members. And I truly thank you, Josh, for all of the work that you have put in to make this possible for our chamber and our community as a whole. So thank you. This has been a long time coming.
Absolutely. Well, I can't wait, and I'm looking forward to the opportunity to serve you guys in a way that is transcendent. Not necessarily me transcendent, but the opportunity to build such a community-oriented program for people who absolutely need it, and we all need it. So thank you guys for the time, and you guys will be getting more information from Alex, so keep an eye out. Thanks, guys.